Okay. Hello, 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 everybody. Happy Sunday. Real quick before we get started, could everybody hear me? We had to disconnect and reconnect and do a whole bunch of stuff the last couple days to make sure that we were good. Because obviously, as you can see in the background, we're not where we usually are, but I just want to make sure that you can hear me good. No worries there. Everything sounds good, all that good stuff. Okay, good. Everybody can hear me. Good. Well, happy Sunday, everybody. I hope you didn't miss me too much. Me and Mr. Chung had a wonderful time with our little time off, enjoying our anniversary, my birthday. I should say, me and Michelle's birthday. For those of us who shared our birthdays together, super fun. But as always, we are officially back. That means that we're going to be going back to our regularly scheduled programming, meaning that every Sunday we're going to have the Sunday shift. And then every Monday, Tuesday, and Thursday, we're going to go back to doing ATITs live. So hopefully you're super excited about that. I know that I am. But this is your time. We do this every Sunday because I get a phenomenal amount of questions on all of my social media platforms. Instagram, TikTok, YouTube, Facebook, everywhere. I get a ton of messages everywhere. So what I decided to do is we decided to do the Sunday shift where you can come in, ask your questions. It can be nursing school related. It can be T's related. It could be past nursing school, being like a graduate nurse. I am here to answer all of those questions for you since, I've been around for a little bit. Just a really quick background on me. I have been a registered nurse now for over 13 years. My background is primarily critical care and emergency medicine. I do a lot when it comes to the ER, CVICU, educating that. And I also do corporate education as well. So been around the block, done travel nursing and all of those things. So I come with a plethora of knowledge and experiences to hopefully, alleviate any stress or concerns you have about the nursing field and things that lead up to it. So hello, hello, hello. Hello, everybody. Hello. It's so great to see so many faces. I've missed you all so much. We are doing wonderful. We had a lot of time to rest and relax. Sometimes that's really all you need. It's just a little relaxation. So yeah, we had a really good amount of time, thankfully, to rest and relax. That's awesome. How do you handle stress and burnout? Great question. So when it comes to stress and burnout, you're not going to completely alleviate that, unfortunately, especially when it comes to nursing school, nursing in general, really anything leading up to nursing. The biggest key when it comes to stress and burnout is you have to, number one, figure out ways to help combat some of that. Meaning that if you are really struggling with, being very stressed out on the job and you're like, you know what, this is that one thing that'll help alleviate some of that stress. Maybe it's reading a book, gardening, going for a walk, whatever it looks like for you. Start to implement those things. Because what happens is we get into our careers and we stop implementing the things that were working before. And then we wonder, why are we so stressed out? Because we tell ourselves we don't have any time for us. Here's the deal, y'all. No matter what career path it is that you all are planning to do, you have got to prioritize yourself. You have got to prioritize your mental health because at the end of the day, nobody else is going to take care of you but you. So please make sure that you're prioritizing yourself when it comes to stress and burnout. Make sure you're implementing those things. And here's the deal. Know when too much stress is your stopping point, right? There has to come a point in time where you are going to reach a limit that you're like, you know what? This is not worth it. This job's not worth it. I need to find something else that's going to make me feel better, that's going to prioritize my mental health. Move on to something else because at the end of the day, if you don't prioritize you, nobody else is going to. So just to give you a little background, I was working as a bedside educator for a period of time. I think it was 2 years before I decided to go into corporate education. And I had reached a breaking point. I had a manager that didn't support me or didn't support the staff. I had a situation where I was trying to advocate for the people that I worked with and they didn't care about it. They said they needed to reach their numbers. They needed to reach their quotas, whatever works for them. I tried to advocate, and unfortunately, my voices were falling on deaf ears. So I had reached my breaking point, and I said, you know what, enough is enough. I'm not doing this anymore, and I'm moving on because I'm not taking this bull anymore, if you know what I mean. So know what your breaking point is and know what's going to help you not be so triggered. That would be my biggest recommendation when it comes to burnout and stress. I see somebody wants to be a paramedic firefighter. I see a whole bunch of people pass their T's. Huge congratulations. Dana says, OMG, same. Now I feel overwhelmed and I stopped thinking about retaking the T's and I'll apply with the score that I got. That's it. I'm done. Can't focus on restudying anymore. Yeah. Know your breaking point. There's going to come a point in time where you're like, you know what? This is enough. And it's okay. And it's okay to walk away. You're not a failure. You know what's best for you. And that's what it comes down to.
Someone asked, she's a new grad, have a hard time finding a job at New York City. Any advice? Feeling discouraged.
So, a new grad in New York City is having a difficult time finding a position. So, my follow up question would be, what do you believe? What is your perception as to the reason why it's difficult? Is there just like a lot of competition? Are you only applying for certain kinds of jobs in New York City that you want to do? Are you limiting yourself to only working day shift instead of working night shift? Like, what is the restrictions? Because I think that would give me a better idea specifically of what the concern is. I will tell you that initially, when you're a new graduate, it is a little bit more difficult to find a position if you limit yourself on your options. And the reason why I say that is because there's a lot of creators out here in the instant messaging, social media space that's going to tell you, oh, no. If you don't want to work nights, don't work nights. If you don't want to work days, don't work days. If you only want ICU, only work in ICU. Here's the deal though, y'all. Realistically, especially when you're trying to get your foot in the door, it's going to be very hard for you to be extremely picky. Not saying that's the person's concern in New York City. I'm just saying that sometimes is what is happening. What I'm finding is when people message me and they're saying I'm having a difficult time finding a position, we end up finding out that they're limiting themselves quite significantly in their ability to find something. So what I will say is, as a new graduate nurse with no experience, be a little bit more flexible. If for some reason, you really want ICU, but there's no ICU positions available, look for PCU. Get started in that front. If, there's no day shift positions, if you can push through a little bit with a night shift position, do a night shift position. That's what I did. When I was applying for positions, it was really difficult for me to find anything. So I ended up working night shift for about 6 months initially, just to get my foot in the door. And then I switched to days in a different career. But, it's difficult. They're investing a lot of money in you to come into an organization and have no experience and teach you everything you need to know, because let's be honest, nursing school doesn't teach you anything when it comes to nursing. And that's usually the problem. So I would say if it is a limitation issue, like you're only trying to find certain jobs, you're only trying to find certain times, kind of open your horizon a little bit and look at other opportunities. You only have to do it temporary. Everything is temporary. You can always move up. And then it just shows that you're more flexible and you're willing to learn and you're willing to do those other things that most people won't. So that would be my recommendation. I applied for the radiology program in case I don't get into nursing. Oh, that's great. Radiology is great too.
How best to transition out of bedside nursing to leadership after 10 years?
How to best do it?
Yeah, how best to transition out of bedside nursing to leadership?
So the question is they want to go from bedside nursing into leadership. They've been doing bedside nursing for 10 years, and they're trying to figure out the avenue that would be best to get them there. This is what I will say. You definitely need to minimally have your bachelor's degree. If you only have your associates, I have heard of managers getting hired with associate's degrees, but they usually want you to minimally at least have a bachelor's. A lot of times they may request that you go back to school for your master's degree in nursing management. But if you've at least got a master's, you can at least get your foot in the door. And when it comes to interviewing, lean in on the fact that you have all this experience. Really talk yourself up. I was the leader of my unit. I was the charge nurse. I had to deal with difficult situations and have examples of those difficult situations because they're going to ask you, give me an example of a time where you had to step up to be a leader. So, for example, maybe you had a patient that was an unsafe discharge, right? I'm just coming up with something off the spot. You had a patient that was an unsafe discharge, and everybody was pushing to get this patient out, because we had to move beds. But you know that they were going to be going home to a difficult situation. So, you, using your managerial skills, stepped up and went to all of your interdisciplinaries and said, hey, we need to figure out a better plan for this individual and talk about, oh, we kept them in the hospital one more night. We ended up putting them in a skilled nursing facility for a couple days or assisted living, something, so that they could get back on track. We ended up reaching out to family so that family knew what was going on, so that they had somebody to go home to in order to be safe when they returned home. Really lean in on that leadership and then come with examples, come with receipts, because nothing is going to get your foot in the door more than receipts. Those receipts will get you those manager positions every single time. You may have to start as an assistant nurse manager. We've all been there. I was an assistant nurse manager too for a period of time. But you may have to start as an assistant nurse manager and then work your way up to management, like higher management. But everybody's got to take those stepping stones to get where they're at. So you're going to be just fine. But really lean in on that leadership stuff. When I become a nurse, I want a nice boss because the ones that I've been with have set you up for failure. And you know what, though? I don't think it's always the leadership that's setting you up for failure. Sometimes I also think it's the upper management. Because let me tell you, just based on my experience, I was a nurse manager on a unit for a very short period of time. It was less than a year, but it's just the point. It was a short period of time. A lot of times, upper management is the issue. It's not necessarily your leader. So you have to think, even as a nursing educator, I got reamed all the time by upper leadership. We need to implement this. We need safer this. We need you to make sure that your nurses are doing this. So they're basically getting their butt handed to them by upper management. And then you've got your staff that you're trying to advocate for that sometimes upper management doesn't want to hear it, right? They don't want to hear it. And that's what I found myself in. I had a situation where we had nurses that were not necessarily prepared when they came off orientation. They were only allowed to have 4 weeks of orientation on a high acuity progressive care unit. It was ridiculous. It wasn't going to happen. It wasn't going to be safe. And I advocated desperately as the educator and the manager to say, hey, they need more time. They're going to hurt people, and I don't want them to be in a situation where their license is going to be questioned. And unfortunately, upper management just reamed me every single day. And at some point, it's almost like your leadership becomes defeated. Because they're like, I want to help you and I've tried to do what I can. And there's just nothing that I can possibly do at this point because I can't get help on either side of the situation. So be a little gentle sometimes when it comes to your leadership. Just know, don't get me wrong, there's poor leadership out there, just absolutely horrible leadership. They should have nothing to do with healthcare. They should go someplace else. But just know that some leadership has reached their breaking point, and that's the reason that they are what they are. They went in with good intentions and advocated, and they just got met with so much resistance that that's what happens. Just to show you the other side. That's all. Yeah. Yeah, if you think about your CNOs, your the person who owns the hospital systems, things like that, they necessarily don't see the bottom layers when it comes to the bedside nursing, CNAs, the people that are really in it, elbows deep in the actual work. They don't see any of that. All they see is the profits and meeting what the investors are requiring and things like that. And because of that, your management, your assistant managers, everybody up until that point, even your educators, are kind of in a situation that sucks because they're either unwilling sometimes or just ignorant to what's actually happening in the healthcare system. And I think that's what's happening right now. And it's really sad to say that, and it sucks, but unfortunately that is accurate to the day and age of healthcare.
You ready for some new question?
Yes, sorry.
Okay. Has been working in an assisted living facility for the 2 years, trying to. I want to try skill, but scared, especially because she never had clinical due to COVID. Any advice?
Great question. So somebody's been working in an assisted living facility for several years and now they want to switch to skilled nursing facility, but they're worried about their clinical skills because let's be honest, assisted living facility, you're doing a lot of things for the individuals, but they're able to take care of themselves. If somebody's in an assisted living facility, it means that they require minimal support, not like maximum support like a lot of these skilled nursing facilities require. So this is what I would say based on experience, and this is just me. Um, Working in a skilled nursing facility, you may go in for an interview and you'll tell them, hey, I don't have a whole lot of clinical skills. I'm really worried about this. Is there some kind of orientation that's going to help me? There are times that they will say, yes, absolutely. We have this red carpet laid out for you of everything you're going to learn. And then what you end up finding out is about a couple days into skilled nursing, some facilities, not all, but some facilities will basically train you for a very short period of time and expect you to know everything and then leave you on your own without giving you the proper things that you need in order to do your role. So this is what I will say. If you're okay with starting at bedside just for a little period of time. Just a little period of time. Get like 6 months to a year in so that way you can build up your skills. I would say start on a medical surgical unit because medical surgical units, while they're not necessarily like full care units like you would see in skilled nursing facilities, it will at least get you started on time management. It's going to be huge because you're going to have a very big patient load in skilled nursing and as well as your clinical skills. They're more willing to work with you because you're just going to be go, 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 just like you would be in skilled nursing facility. What my main concern is that if you switch from an ALF to a SNF, and then you get into a situation where you are not trained appropriately because you're just at like that facility, I don't want you to put your license at risk because you didn't get what you needed. Because when you sit in front of a board of your peers when it comes to the state boards of nursing and you tell them I was not provided the skills that I needed in order to be successful, if you harm somebody, they don't care. So I always say CYA, protect your and cover your butt constantly and make sure that you have what you need before you go into that situation. If you absolutely want to do sniff, it's okay. Just maybe go to the bedside where you're going to have a little bit more time, a little bit more education, build up on your skills, and then go back to a sniff. That would be my recommendation if you can. I'm currently starting my clinicals in ICU. Am I able to add this to my resume at all? Oh, yeah. When you are going through the graduate nurse process, like when you finish school and then you're trying to find a career in nursing, you can list all of your skills. So, or all of your clinicals, I'm sorry. So you can say, oh, I did clinicals at this ICU. I did clinicals at this med surge. I was at this assisted living facility. I was at this mental health facility. List all of that and how long you were doing those particular clinicals, so that way they have like a good idea of like what you've seen so far and if you'll be a good fit. And then here's the deal, really figure out your interviewing skills when it comes to graduate nurse interviews. Because a lot of times, especially with the more competitive units, they are going to want you to be able to interview at a higher level. They know that you don't necessarily know everything, but they're going to hope that you at least know some things. So really get into like, knowing about sepsis, knowing about like infection prevention things, CAUTIs, CLABSIs, things like that. Really get into those things. So that way when they start interviewing you and they say, tell me about a patient that you've taken care of, go above and beyond of like, oh, I took care of this patient, they were sick, whatever. No, I took care of this patient. They actually they were a huge infection prevention risk. They were at risk for sepsis, CODI because they had a urinary catheter, CLABSI because they had a central line, in their jugular. I was constantly taking care of them. They were on high dose antibiotics and pressors. Like, really know things when you step in if you really want to get into those higher acuity types of units, because that's going to set you apart from the rest. It's going to be huge.
You ready?
Yep.
Okay. What is the advice for first semester, and what is the advice for people that struggle with patho, like understanding patho?
Okay. So I'll start with the pathophysiology. So somebody said, "What's my advice for pathophysiology and how to study for that?" So my biggest advice to you is to question what is happening with pathophysiology, why is it happening with pathophysiology, and how does it affect the body systems? Because that is how you will learn how to study for pathophysiology when it comes to trying to remember and retain the information later. You're definitely going to have to start learning this way when you go through nursing school, because nursing school is going to kick your butt when it comes to pathophysiology and all the different disease processes. So if you can figure out how the body systems work, what happens if the body systems aren't working appropriately, and then how the body systems are interconnected if something was, for example, not working appropriately, that's going to help you tremendously when it comes to pathophysiology. We're actually going to be working on a series about pathophysiology over on the YT channel. Highly recommend that if you're not subscribed there, that you subscribe, because I really want to get into the nitty gritty. I want to do mind maps with you. I want to really get into why things are happening. So that way, when we talk about disease processes, you're going to start clicking those things together. So that's what I would say with studying for patho. When it comes to studying for your first semester, here's the deal. Time management is going to be key when it comes to your first semester. You cannot fall behind in that first semester. The reason why is that if you even fall behind just a little bit, you're going to be behind a lot, because there's just so much material and things that they're going to throw at you. I mean, they tell you all the time, nursing is one of the hardest programs that's out there, because you just learn so much within a short period of time. So you've really got to make sure that you're staying on top of everything, that you've got good time management, get a good calendar, things like that. That's going to help you tremendously. When it comes to studying, you have to completely change how you've studied up until this point. You cannot study for nursing school how you studied for your prereqs. I'm going to say that one more time for my people in the back that didn't hear me. You cannot study for nursing school the same way you studied for your prereqs. Prerequisites, what you do is you memorize, regurgitate that information, and completely forget it. Let's be honest. I can't remember anything from the reading class that I took. In nursing school, you got to remember everything. Everything. You've got to remember everything. Even when you leave that class and go on to your next class, that information doesn't go away. That information is there and it stays. So you have got to really understand, just like we talked about with pathophysiology, you have got to understand why things are happening. What is the outcome of those things that are happening? What are the signs and symptoms, and how does it affect the body systems with why it's happening? And then what happens if I don't address it as a nurse, right? What's going to be my intervention, and what will happen if I don't address it? Will my patient die? Will my patient not die, right? You've got to be able to answer those questions as you're going through nursing school. It's especially important in your first semester. So really get into, I'm just going to say retention. You've got to get into retention. I did active recall. I got a whiteboard. I wrote everything down, and I just regurgitated what I remembered. So basically what I would do is I get a whiteboard and I would write everything down. I would say, okay, I can't remember anything else. I would go back to my notes, and whatever I miss, that's the stuff that I need to study, because that's the stuff that I'm forgetting, right? You will have to figure out study habits that work best for you. The teachers are not going to necessarily teach you everything. They're going to tell you a lot. Refer back to your book. Refer back to your book. Have you read your book? It's going to be a lot of that. So you've got to figure out what works best for you, and you might have to get a study group. Find a study group that's effective, not one that's venting. Find a study group that's effective. Find either flashcards, whiteboards, digital notes, whatever works best for you. Really get into that and just know that this is going to be your life for at least 2 years. So sometimes, you'd want to go to that party on Friday, but you got a big test on Monday. You may not be able to go to that party, right? You're probably going to have to spend Friday night studying. You might have to make adjustments to your lifestyle, and that's okay because the reward at the end of this is going to be huge, and you'll make up for all that in a couple years. So that would be my recommendation.
Yeah, someone asking, is it the same idea of how to study a patho go for A&P also? Like A&P in
Yeah, A&P pathophysiology, it's literally the exact same way. I'll tell you that before you even start nursing school, you have really got to um, build up your critical thinking. I think that's like the word that I'm looking for is critical thinking is going to be key because as you're taking care of a patient, you might come into a room and you might be like, okay, so this patient has a really high fever. Let me look at their labs. Let me see what's going on. I know that because they have a fever, they most likely have an infection. Oh, look, their white blood cells are high. Okay, that makes sense. Let me see. Oh, their blood pressure is actually starting to trend downward. So I see that we have organ involvement as well as an infection. Let me see what else. Oh, their respiratory rate's kind of high. So again, we're not looking at a good situation here. So what do I have in a situation where I have a patient who has a fever, so they've got an infection, their blood pressure is low, their white blood cells are high, their respiratory is trending up. Oh, they have sepsis, right? Because sepsis is a systemic infection of the body. And with it affecting the body, it's going to eventually start affecting your organ systems. So that's what you have to learn. That's the critical thinking piece that you have to figure out. You've got to figure out what's normal, what's abnormal, what happens if I don't do anything about it. That's the stuff that you've got to start like drilling into your head. And that's the way you have to learn in nursing school because let's be honest, none of us do that in our prereqs. So you've got to have like a completely different way of thinking when it comes to nursing school. Any other questions, Mr. Cheung?
Yes.
Okay, sorry.
Advice for people that haven't been in bedside nursing for a little bit, like doctor's office or whatever they're doing, trying to get back on bedside.
Oh, I love this question. I'm like an expert with this question. So the question is for people who haven't been at the bedside for a little bit, so they maybe were working in doctor's offices, maybe they were at an ALF, sniff, something like that, and now they want to get back into like the actual bedside piece. Fantastic. A lot of hospitals, not all of them, but a lot of them are offering something called a transition to practice program. So basically what it is that whether you've been away from the bedside for 10 years, 20 years, whatever it looks like, a lot of these hospitals have these programs in place that will get you back to where you need to be in order to be competent at the bedside. Because let's be honest, bedside nursing is crazy. There's so much stuff that we have to know. Patients deteriorate like crazy. You just have to be on your feet. So, number one, look for hospitals that offer that. Number two, if you don't have any hospital that offers that, what I would say is go out and apply. Really push in on the fact that you've been dedicated to this career, that you're really wanting to like make your way up. You want to try something new. That you have all this experience that can translate into bedside nursing. It's just that you need the pieces that you're missing when it comes to like critical thinking and clinical skills that you may not have necessarily had when you were working off site. A lot of times, if you can kind of build on that in your interviews, that will help tremendously. I know sometimes hospitals won't want to hire individuals who've been away for a long period of time because let's be honest, it's basically like being a graduate nurse all over again. You're starting from the bottom up, right? I would also say look for units that are a little bit easier when it comes to clinical skills. I would say start with like a medical surgical type of situation, maybe something that's very specialized like orthopedics, like something that's a little bit like easier when it comes to like figuring out what it is that you need to do as you're working. If you're trying to go from like a skilled nursing facility to ICU, that might be a little bit more difficult because not only you're having to learn basic skills, you're also having to learn critical skills, right, to keep individuals alive. So you might have to start a little bit lower, and that's okay. Put in your time, work your way up. It'll be a tremendous help in the end. But yes, look for hospitals that have that transition to practice program. It's huge for individuals that are wanting to go back into the bedside. And if you can't do that, you've really got to get those interview skills. Maybe even do like an RN refresher course. There's a ton of them out there. A lot of RN refresher courses like give you hands-on experience. They help build up maybe skills and things that you've lost over the years. That could also be helpful too. Hello. I was a straight A student, and I'm concerned that by going to nursing school, I won't be able to maintain my straight A's. um, Here's what I'll say. Is it impossible to get straight A's in nursing school? Absolutely not. You absolutely can. Is it very difficult in order to get straight A's? Yes. I had a professor because I was a straight A student. I had a 4.0 GPA when I went into my program. And my first semester, I almost failed because I didn't know how to study and I didn't know how to retain the information. And I had a professor that came up to me because I was literally breaking down, or nowadays the kids call it crashing out. I was crashing out because I'm like, I can't get an A to save my life. And I had a professor come up to me, or I shouldn't say professor, she was a clinical professor that came up to me and she said, honey, C's equals degrees. They are not going to bash you if you get a C. I got one class I got a C in. It was pediatrics. It was the most difficult class for me because there's just so many different things that you need to know. But at the end of the day, most of my classes were B's. And guess what? I still got a job. And once you get experience as a nurse, you're going to reach a point where nobody's going to ask you what your grades were in school. They don't care. So go in with the expectation that there's a chance that you may not get the grades that you want, but just know that if you finish nursing, you are already light years ahead, right? C's equal degrees. If you get a C in every single class, you're still a nurse. I'll tell you this. I had people in my class that got straight A's the entire nursing school. They were extremely book smart. When they got out and went to the bedside, they were not bedside smart at all. And guess what they're doing now? Not nursing. But guess who, the B and C student that barely made it, but barely made it. And I'm doing great, right? It's okay. It's okay if you don't get straight A's. It's not going to make or break you.
What if you want to go for a master or DNP program?
What, like with the C's equal degrees?
Yeah.
This is what I'll tell you. If you want to go for a master's or a like a DNP program, a lot of times they're not looking at your bachelor's grades or your associate's grades. They're actually looking at how long you've been a nurse and where you've been working. So when I applied, I did apply to be a family nurse practitioner. I decided against it. Partially of the way in, but they did not give a crap about what my associates and bachelor's grades were. They just didn't care. What they asked is how long have you been a nurse? What nursing specialty did you work in? What did you learn from those specialties? Why do you want to be a family nurse practitioner? That's the stuff they care about. Sometimes you may even have to take the GRE, depending on the school that you're going to. It's basically like the TEAS test for master's degrees. But sometimes you have to take that, and then they'll weigh that more heavily more than anything else. But I can tell you they did not care. I got it on my first try for my F&P program. That was thankfully a program where I didn't have to take the GRE, and it was solely just based on my interview. So don't worry too much. Trust me, what is meant for you will be meant for you, and you will get there. It's just, unfortunately, sometimes you're going to get bad advice where people are going to say, no, you have to get the highest grades possible. It's just not possible all the time. Here, let me tell you, because I was actually looking at this with Mr. Cheung the other day about what our grading scale looked like in nursing school. So I just want you all to be prepared for it. because what you think is typically the grading scale in your prerequisites is not the grading scale in your nursing program. So, for my family, not my family, my fundamentals of nursing class, the grading scale, here we go. So, in order for you to get an A in my class of fundamentals of nursing, an A is 100 to 92%. It's not 90 to 100. It's 100 to 92%. A B is 91 to 85%. Not 90 to 80, 91 to 85%. And a C is 84 to 78%. Not 70. So if you get anything less than a 78% in this class that I took, you basically have failed because you can't move forward unless you have a minimum of a C. So also be prepared for that, because that's also going to be very different for a lot of you that are doing your prereqs, is that the grading system is extremely different in comparison to your prereqs.
Everyone panicking.
Don't panic. It's okay. I just want you to know before you go to like your nursing your nursing orientation for school, just know that you're going to see this and you're going to be like, "What?" Yeah, it's unfortunately depending on the school, everybody's grading system is very different. I see Kiki says that an A for her was a 94 to 100. Just know that it's going to vary slightly, but it's always going to be like somewhere in the upper 70s is like the cutoff. If you can't get in that upper 70s, they can drop you from the nursing program. Manny says, the grading system sounds delightful.
So there's a couple of questions.
Okay.
Two-part. Advice on starting nursing school, like what they need to prepare, what
Okay.
they need to be worried of.
Uh-huh.
And then the other part, the other question is it possible for new grad to go to specialty like NICU, ICU?
Oh, yeah. Great question. So the first part of the question was, what do I need to know prior to getting into nursing school? Is that right?
What do you
Yeah.
what you need to expect and stuff? How to prepare?
So how to prepare. So how to prepare before you start nursing school? Great question. My biggest thing before you even like get into all the nursing school nitty-gritty is know your anatomy and physiology like the back of your hand. If you look at the back of your hand and like, oh, there's a mole there that I never saw before, you don't know anatomy and physiology, right? You have got to know A&P like the back of your hand, because your teachers are going to tell you, I am not teaching you A&P. That's something that you passed already that you should know. So the quicker that you can figure out pathophysiology and anatomy, the better off you're going to be in nursing school. So really drill that into your mind. The other thing is just to get you a step ahead, know your dosage calculation. If you have a really difficult time with math, it is not going to hurt you to spend a little extra time learning about dosage calculation prior to getting into nursing school. So that way you're already a step ahead. The biggest thing that I also tell people too is to learn your medical terminology, because medical terminology is going to be key. Because if you can't figure out what something is, if you can break down the word, you are going to be able to figure out what it is that they're even talking about. So for example, if you didn't know what hypertension was, you could say, okay, the prefix hyper means elevated or high, and then tension is like tension like in the blood vessels. So it's just a high tension inside the blood vessels. That's what it means. You're going to come across that a lot when it comes to nursing school. So if you can know your medical terminology and how to break it down, super helpful for you. Now, when it comes to preparation, get a calendar right now. If you're about to get to nursing school, get a calendar right now that was going to work best for you, because what's going to happen is that your classes are going to start to send you syllabuses of when assignments are due, when you have to do clinicals, when you have to do lab checkoffs, when you have tests, when you've got class. You need to write all of that down. And I would always say work 1 to 2 weeks ahead when it comes to like assignment submission and things like that. Reading assignments, all of that, because the more you can work ahead, the easier it will be. You will be less likely to fall behind. If for some reason something happens, say like you had an emergency, if you're a little bit ahead, that's great because now you've got time to spend on that emergency before you have to get back into the books to get caught back up again. So, get a really good calendar and really figure out what time management is going to look like for you and organization because it is super easy to fall behind in nursing school. Trust me, I know. I did it in my first semester in pediatrics because I was losing my mind in the chaos. So you've really got to really get into time management, organization, working ahead. Um, and those are the big things. Now, when you go to orientation is going to give you a lot of information. They're going to tell you about different ways to be successful in nursing school. They're going to talk about study habits. They're going to talk about the grading system. They're going to talk about what happens if you miss clinicals. Like they're going to go over a whole bunch of stuff with you. Um, just be very prepared specifically that you're going to be spending a lot of time doing a lot of things on your own. So if you're not the type of person that likes to study by yourself, you can come study with me. We are going to be bringing nursing school studies tips and habits back again here fairly soon. But find a study group, right? Get to know your people. Get to know your people in nursing school. Once you get in there, start developing study habits. Go to the library. A lot of times the library has like individual rooms with whiteboards in them so that you can write stuff out and break down different disease processes and things like that. But really figure out what study looks like for you because unfortunately you will be doing a lot of it by yourself. And this is what I'll also say about nursing school friendships. Not that anybody asked it, but it's just a good thing to know. Nursing school friendships don't necessarily last forever. I haven't spoken to anybody that I went to nursing school with ever, to be honest. I think we maybe stayed in touch for like 6 months after we left. You're going to build new relationships and connections when you actually get into nursing, right? So you're going to build those relationships. And some of those relationships will last. One of my very good friends, Mandy, was a nurse with me on my very first job as an orthopedic nurse. So we stay in contact constantly, but to be honest, she's probably the only person I ever talk to. Just know that friendships come and go. If there's like drama and things that are happening in your nursing program, just know that you've only got to deal with that for a couple years. And then once you're done and it's over with, you're probably never going to see those people again. You know, just keep that in mind because nursing school can be dramatic. Was there something else to that question?
New grad, can they go straight to
Oh, that was
specialty
the
like
other one.
ICU or ER?
Thank you, Mr. Cheung. I forgot that one. So, can new graduates go into specialties like ICU, NICU, things like that? Absolutely. Absolutely. I went straight into ER. ER doesn't seem like it's a specialty, but it is. It is. ER is a very different beast when you think about it than bedside nursing. So, I guess they're both bedside nursing, but it's a different way of thinking. But can you go into like different acuities? Absolutely. Will it be a little bit more difficult? Yes, because everybody wants those jobs. Everybody wants ICU. Everybody wants NICU. Everybody wants labor and delivery. Everybody wants trauma, right? Everybody wants ER. Everybody wants those more highly valued jobs. You get paid more usually when you're in higher specialties. That definitely helps. And it's more desirable because it's hard to find people who are experienced in those specialties. So is it difficult? Absolutely. That is why you have got to have your interview game on strong. You've got to figure out how to interview for these higher specialties because an interview for a medical surgical unit is going to be very different than an interview for an intensive care unit, right? Because medical surgical is not going to see the extensive and high acuity that ICU would. So that interview may just ask you, how's your time management? How are you able to handle like, a heavy patient load? What was your experience in clinicals when it came to taking care of like full care patients where they have to, be bathed and help to the restroom, maybe poop on a bedpan, things like that. Versus ICU is going to be more like, what is your critical thinking? Have you handled high intensity drips? Have you heard about vasopressors? What was your experience in clinicals with that? in respect to the specialties. So is it completely impossible? No, but you've got to have your interview game on strong. And if you can get an externship while you're in nursing school with a maybe like a NICU, labor and delivery, ICU, whatever it looks like, if you can get your foot in the door, it helps you tremendously in comparison to not having an externship. Because if they see, oh, this person really works hard, we're supporting this person, we're excited for them to finish nursing school, trust me, you're going to have a job when you come out. So that would be my recommendation when it comes to like how to get your foot in the door with those more higher specialties.
All right, you ready?
Yep.
Double question.
Okay. Hold on. Let me write it down because you keep asking me double questions and then I forget. All right. Go ahead.
How to study for fundamental or pharmacology? Any key tips? Like they have hard time grasping what is important.
Okay.
Like those two top.
Yeah. Oh, it's technically the same question. It's just different classes.
Yeah.
All right. So, how to study for fundamentals. So, when it comes to fundamentals specifically, there's very specific things that you're going to be learning in fundamentals. So, here is kind of like a little list of the things that I learned. So, laboratory demo practice is going to be huge. You're going to have skills checkoffs when it comes to fundamentals. So, a lot of like infection prevention, sterile technique, you're going to be doing vital signs, NG tube feedings, basic mobility, so like walkers, crutches, things like that. Physical assessment, hygiene, enemas, those are fun. Pulse oximetry, oxygen administration, I&O, meaning what they take in, fluid, IV, food, things like that, and then what they put out. So poop, pee, drains, and stuff like that. Specimen collections, dressing changes, and like documentation. So skills is going to be a lot of the stuff that you learn in fundamentals because they're basically teaching you just basic nursing. The reason they do this is because when you finish fundamentals that first semester, you can typically start working as a patient care technician in a hospital and getting your externship going. If that was something that you wanted to do, if you wanted to work part-time or PRN as needed. Other things that you're going to learn too is like safety in healthcare. Infection prevention, I'm going to tell you, is going to be huge in nursing school when it comes to fundamentals. You're also going to learn about like OSHA standards and like, how to keep yourself safe, things like that. Communication's also going to be a really big thing. You're going to learn about the nursing process. You're going to get sick and tired of hearing about that. Clients' basic needs, assessments, nursing diagnoses, not fun. Safety and security needs. So like patient safety, tobacco cessation, we're always big on like stopping habits that are going to make disease processes worse. One being tobacco, one being alcohol is a huge one. You're going to learn about that. Comfort and pain. Pain is very different for each individual, for each patient. Physiological needs. So that's like your Maslow's hierarchy of needs. Number one is always going to be like your ABCs, your airway, your breathing, your circulation, because those things could potentially harm patients. But like temperature, oxygenation, rest, sleep, nutrition, fluids, elimination, like, urinary and defecation, mobility, immobility, sexuality, right? Sexuality is going to be huge. You're going to be taking care of patients that you may not necessarily always be comfortable with, right? If you're not the type of person that is not very abreast of the different kinds of like sexualities and things that are out there, that might be very difficult conversation for you. So be very cognizant of that because you will be seeing anybody and everybody. Spirituality, culture, end of life grieving, and like physiological needs. So that's like the big stuff in fundamentals. It's literally just teaching you kind of like basic nursing and how to care for patients at like a patient care tech type of level, while also mixing in some like very like nursing skills and things like that. Fun when it comes to pharmacology, the big key when it comes to that one is you've got to know your mechanism of action. Let me rephrase that. Number one, when it comes to pharmacology, is you need to categorize medications, right? So if the medication ends in LOL, then it is a beta blocker, right? If it ends in a statin, Statin, then it's most likely a cholesterol medication. So if you can start bundling medication names together into categories of what they are, a lot of them have the same kinds of things. They have the same side effects, they have the same mechanism of action, not always, but sometimes. They have around the same mechanism of action. The same nursing interventions are going to apply with a lot of these. Like, for example, digoxin is a common medication that you'll see out there. You have to get an apical pulse, meaning that you're going to have a stethoscope in your ear and you're going to be listening to somebody's apical heartbeat for a full minute to make sure that we don't harm this individual, because digoxin can become toxic really quickly if it's not given correctly. So, categorize your medications, learn about the categories, know your mechanism of action, know your signs and symptoms of what it is that you're looking for, meaning that the medication's probably not doing what it's supposed to do, or it's a common sign and symptom of the medication, and then know what you're going to do as a nurse. It's a lot of information. I'm going to be 100% transparent with you. You're going to be like, oh my gosh, I can't retain any more information. That's why active recall is going to be huge. Read your notes, study, write down what you can remember, and then when you can't remember anything anymore, go back to your notes, see what you miss. You're going to do this over and over and over again until it becomes second nature.
And then someone say shout out Maslow and Skinner. I guess is that a topic?
Maslow's hierarchy of needs is like the big one. A Skinner, I think, is like another is another. Wasn't he a psychologist? I think he was a psychologist, Skinner, if I'm not mistaken. Like learning about patient psychology, right? Because let me be honest with y'all. Working in healthcare, I've taken care of a lot of Baker Act patients, Marchman Act patients, different kinds of psychological disorders. And I'll tell you, one of the most scariest clinicals that I had was mental health. And the reason why is because
Yeah, and psychology.
it is a psychology. One of the reason why mental health was so scary for me as a clinical was because we were in a lockdown unit type of deal. So you're basically in a room with a bunch of people that are maybe suffering from different things. You could have schizophrenia, you could have people with bipolar disease, multiple personalities. You can have, I mean, there's just so many different mental health issues, and they're all usually taking their medications and they're fine, or they're placed in a room whenever the clinical people are there so that they don't harm any of the students. But you're kind of put in this very intense, like, that's why I like shout out to psych nurses, because you're put in this very intense situation, right? You've got people banging on doors, you've got people screaming, you've got people that maybe are sitting in the corner that are having a little bit of a crisis. There's just like so many things that are happening, and they've got to stay on top of that and abreast to that, and it becomes overwhelming. So mental health was very scary for me, but it was very eye-opening to the things that the general public doesn't necessarily see.
You ready?
Yeah.
How do you deal with when a new nursing student get eaten alive by older nurse or nurses above you?
Oh,
Go to clinical, you got the
let's talk about this. So the question is how do you deal with as a new nursing student, and you're getting eaten alive by older nurses or nurses that are above you, and you're dealing with that in a clinical setting? Because it happens whether you're a new graduate or you're in clinical. So it's going to happen. Let's be very transparent. You are going to be in a situation where you may be uncomfortable with the preceptor that you have, or that individual is not matching your vibe, as I would say. In those situations, number one, know that the problem isn't you, it's them. Something is happening. Maybe we were talking about before, they have reached their breaking point and they can no longer function anymore because they're in that position and they don't know that they can just get out. So you may have that preceptor. You may have preceptors that just hate nursing students. I mean, they exist. It sucks, but you may just have a preceptor that just hates you as an individual. You have one of two options. Number one is you can just deal with it. It's only a short shift. Sometimes it's like 4 hours, 6 hours, maybe eight. Eight is more like when you get towards the end when you start doing your practicum. But usually it's like 4 or 6, somewhere in there. And 12. 12 would also be like 8 to 12 hours for practicum. You can just stick with it and deal with it and then hope you don't see that individual again the next time that you go back. You can also, when you're looking up, usually like the night before, you'll go look up a patient that you want to have the next day. Look to see if that nurse is working the next day and who their patients might be. I always used to ask the charge nurse, like, hey, so and so and I don't really get along that great. Are they potentially working tomorrow? And if they are, do you know like what patients you're going to give them? That way you can just avoid their patients altogether. So that's number one. Number two is if they're just being rude and nasty, go to your professor. You should have a clinical professor, somebody that's with you, and just say, hey, I'm really trying. Be gracious, be understanding that nursing is a high stressful job, but just say, hey, I'm having a really difficult time connecting with this preceptor. I know that they have my patient, but I'm not getting the clinical experience that I need. I'm worried about it. And I'm wondering if maybe I could switch or there's some other options. Usually your clinical professor will tell you, all right, let's look and see what we can do. And they'll figure it out for you. So your clinical professor should be on your side. If your clinical professor tells you that, oh, well, this is nursing, suck it up, those are the very bad clinical instructors. I've had them. But just know that a lot of times they are on your side. You just have to talk to them. They're not as scary as they seem. If you are unable to get help by your clinical professor, even if you have to go to the charge nurse and just say, hey, is there somebody else I can follow for today? They may not necessarily have my patient, but can I just follow somebody else that may be a little bit more receptive to a student? They may be able to help you. But if you're getting it from both ends and nobody's really helping you out, that might be a conversation that you might have to have with an advisor of your school. This is what I'll say. Keep good documentation. This will save you in nursing and this will save you in clinical. Keep good documentation about everything that happens. So if you have a really crappy preceptor, make sure you have the preceptor's name, not the full name, but just the first name in the unit. When you were there, the time you were there, what you experienced, and make sure that you let people know either by email, something where you've got a paper trail about what's going on. Because if you're not getting help, you have that avenue of documentation to protect you while you're in your program. I've seen too many times where we've had nursing students that was not getting any assistance, and advisors would be like, why didn't you reach out? Why didn't you talk to anybody? Well, if you've got receipts, they can't say anything to you. So you may have to move up all the way up to the dean of nursing if it's not addressed when it comes to that kind of situation, specifically in clinical. If you and your professor's not helping you and you're having a preceptor situation, that would be my recommendation to you. I have seen it 9 times out of 10 work out well because you've got really good documentation. As a nurse, same situation. I can't tell you how many times I got bullied by other nurses, management, charge nurses, but I had receipts. I had documentation. So if they tried to say, oh, well, you're not giving your 2 weeks, why are you leaving? I said, oh, no. I've been doing this for the last couple months and nobody's been on my side. So I'm not giving you 2 weeks. I'm leaving now because you all had time to address the issue and you chose not to. So you have to advocate not only for patients, but for yourself. So always have good documentation about what happens. I would also recommend that if you've got a crappy preceptor, is trying to just have a conversation. Just be like, hey, are you okay? Is everything good? Sometimes that also helps because they may not necessarily realize they're doing it unless you have that conversation with them too. So I can speak from crappy preceptors in the nursing program or in graduate nursing because I've been in that situation. You can always switch preceptors. Nursing school is a little bit more difficult, but just know that you've got to figure out who's going to have your back. Somebody's going to have it. You just got to figure it out and keep your receipts. Yep. Keep good documentation. Keep a little booklet, email, times, dates, names, and convos. That's right.
Can you look
Yeah. Is it the last one?
Yeah. Big.
S- So on Instagram, it says, I just started nursing school. I'm confused about the nursing process. I understand AdPi, but they're using AdoPi. Interesting. So where do I set the SMART goal? Would it be an outcome identification or planning? First of all, you're gonna have to forgive me. Nurse Chung has to look up what AdoPi means because I've never heard of the O being added. Oh, outcomes identification. Assessment, diagnosis, outcomes identification, planning, implementation, and evaluation. So the outcome identification, identifying measurable, achievable, realistic, and culturally appropriate expected patient outcomes, often using SMART goals. So, okay. So they moved it there instead of planning, I guess. So I don't understand what the difference is. What is planning? Develop a plan of care. Oh, so you're doing the plan of care. Plan of care. Okay. So I think that a lot of schools started implementing the O because they're trying to help you build critical thinking. I think that's the reason why. So, assessment, you know what assessment is when it comes to AdPi, right? That's literally you just looking at the patient, trying to figure out what's going on, what's their health history, physical exam, things like that. Diagnosis is you identifying any like actual potential health issues. That's like your nursing diagnosis is like failure to thrive if they're not eating or drinking, things like that. Your different nursing diagnoses. So then you have outcomes identification. So outcome means like even when you're nursing, like you're going to write this on the whiteboard as you work in the bedside, you're going to say, well, what's the outcome for today? What is the goal? So if you have a patient who's failure to thrive, why are they failure to thrive? Is it because they are just refusing to eat? Is it because there's a medical situation where they can't eat? Things like that. Then you might say, well, what's the goal for today? The goal is that if they can't eat, maybe I want to put them on total parental nutrition, TPN. So that way they're getting their nutrition so that they don't waste away, right? So that's technically where you would put your SMART goals. Be very specific about your goals. It has to be measurable. And usually it needs to be for that shift. So patient will tolerate TPN for my shift. It has to be achievable. It has to be relevant. It has to be time bound. So then the planning phase, that's where you're actually going to start doing the plan of care, right? You're going to start establishing priorities. You're going to start looking at like evidence-based interventions. So based on the fact that they need to take their TPN, what am I going to do? Well, my plan of care is I'm going to get with nutrition, and I'm going to make sure that nutrition is on board. I'm also going to make sure that pharmacy is on board because they're most likely the ones going to be giving me the TPN, depending on the hospital. Sometimes it's nutrition, sometimes it's pharmacy, but they're going to be the ones giving me that, like really laying out like what is your day going to look like? How are you going to implement that? What is your plan of action? That's your I. What's your nursing interventions, coordinating care, things like that. And then evaluation, like how did it go? Did they tolerate it? Did they not tolerate it? Things like that. I know that was like a lot of information, but yeah, I guess they're implementing the O so that you can add your SMART goals there. Any last questions?
Okay, so 2 parts.
Okay.
So, where do you recommend a new grad nurse should work after passing the NCLEX? A, and B, which department or area should they go for as like best for nursing, or just to get their foot in the door in the hospital setting?
That's best for nursing or where to get their foot in the door.
Yeah.
I'm writing it down because Mr. Cheung likes to give me a whole bunch of questions and I can't remember them. It's okay. It's okay. So the first question is where do you recommend working as a new graduate? It's really up to you. You can literally work anywhere. The possibilities are endless. The better you are at communication, the easier it will be for you to get your foot in the door in the more difficult places. I hate to say it like that, but if you go in for an interview, and here's the deal, y'all, for a lot of generations, not necessarily maybe my generation or the older generations, but the newer generations that are coming out of nursing school, Some of y'all show up to interviews not right. Let's talk about that. So when you go to an interview, please like have like a nice shirt on, have a nice pair of pants on, maybe like a jacket, have your resume printed out, like just like basic resume interview skills. The reason why I say that is I can't tell you how many times Hoochie Mama McGee came into my office for an interview and was wearing very, very short shorts, like a crop top shirt. Like, go in for like you actually want the job. This is what I will say. Actually go in like you want the position. Dress nicely, have the correct stuff on, have your resume printed out. It goes a long way in the interview process. So that's number one. When it comes to like communication is like you've got to know your hospital. So sometimes, most of the time, the hospital is going to go, why do you want to work here? Why do you want to work on this unit? You can literally do a quick Google search about the organization, any like big initiatives that they've got going on right now, or maybe information about that specific unit that you're interviewing for. If you can go in there when they ask you about why you want to work for this organization, it's going to help you tremendously. So they may say, why do you want to work here? Well, I heard about blah 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 hospitals actually has this huge initiative right now where they're seeking magnet status, and I think that's great because you can do a little bit of research on magnet. I think it's great. Magnet says that you are the creme de la creme of hospitals. You meet certain safety patient standards, certain standards of your nurses, and I really want to work for an organization that is meeting and exceeding those expectations. That means that I'm going to feel safe in my role. The other thing is that I heard about this ICU just recently had the last 90 days without any patient infections, which I think is great because that means you actually care. But if you literally can talk these people up, it's going to help you tremendously when it comes to your interview. The other thing is like know your disease processes. If they're like, talk to me about a patient that was difficult for you and what you did. Get the most critical patient you can literally think of. I had a patient that was in severe sepsis. We ended up finding out about it because their white blood cell count was high. They were starting to potentially have organ dysfunction because their heart rate was starting to get really high. Their blood pressure was getting low. We ended up putting them on fluids. They were on pressors. We got blood cultures. Their lactic acid was above 2. If you can know those high critical things when it comes to interviewing, you are absolutely going to get your foot in the door. Because they're going to go, oh crap, not only does this person like know about the patient population we're going to be seeing, but they also know about the organization and the things that we have going on. That means that you went above and beyond and you did a little bit better than what most people will do, as well as dress nice and bring your resume with you. So that would be my biggest key when it comes to like getting your foot in the door for any position. It doesn't matter what position it is that you want. You can apply for them all. See who calls you back. I will tell you that if you were very concerned about maybe like your clinical skills, you didn't really want to have a very high patient population, start at the lower acuity units like your medical surgicals, things like that. But if you felt like, I really think that I can thrive in a ICU atmosphere, or maybe I want to try a PCU first and see how it goes, apply for those. There's nothing wrong with that whatsoever. So my recommendation for new grads where to start working, it's really dependent on you and what you feel comfortable with, which department to work for that's best for nursing or get your foot in the door, any department. Like I said, if your interview skills are on point, you're going to get any job that you want. You just have to figure out how to interview and have to, for lack of a better word, suck up a little bit to where it is that you're interviewing at to get to where you want to be. Unfortunately, healthcare in general is just about sucking up to the right people.
Can you refer back to your Instagram question, second question, basically?
When they refer to the nursing process, are they referring to ADPI? Are they referring to, sorry, I missed it, clinical judgment model? So usually when they're talking about the nursing process, it's the ADPI or the ADOPI. The clinical judgment model is a little bit different. That is, so hold on. So the nursing process specifically is the ADPI. The clinical judgment model is the newer one that has the O, I think, if I'm not mistaken. Because the reason why they developed the critical judgment model was to help you with like decision making, what your decision making is going to look like, how to build critical thinking. Because the NCLEX, when it switched to the next gen NCLEX, it has a lot more critical thinking questions. And they weren't necessarily teaching you a lot of critical thinking in nursing school back then. It was really just like how to pass the NCLEX. But now you've got to get, you're basically going to get like a patient scenario and you've got to figure out how you're going to take care of that patient in order to pass the NCLEX. So I think that's maybe the reason why they implemented the ADOPI. But I think it's more related to the clinical judgment model. There's no reason to be scared when it comes to nursing. I'll tell you that there's a lot of things that people go, "Oh my gosh, what am I getting into?" But at the end of the day, like nursing is so rewarding. There's endless possibilities. It's not just like the fact that you can literally work anywhere, especially if you're a bedside nurse, you can work anywhere. You can even move up if you want to be like management, upper management, nursing education, whatever that looks like for you. You just have endless possibilities. And if for some reason maybe you had to move states, right? Maybe you're like leaving one state and going to another state, you can literally pick up in another state and find a job pretty easy, especially when you have experience. So I don't want to scare anybody from nursing. Nursing, just like any job, is going to have its things, right? You're going to have crappy coworkers sometimes. You're going to have crappy management sometimes. Like every job has something, right? Nursing is another one of those jobs that has crappy situations, but you are in a powerful position as nurses to be like, I'm not doing this anymore. And I'm not dealing with this toxicity. Peace, right? You can literally go anywhere. Nobody's going to be like, why did you stay at this job? You can literally say, it was a very toxic environment. I wasn't learning. I wasn't growing. I didn't feel like they were providing me with the things that I needed. And I decided to move on to other opportunities because I want to be the best of the best when it comes to nursing and advocate and keep my patients safe. Boom. That shuts that whole conversation down. Right? There's just so many things that you can do, so many avenues, not even talking about just the monetary. The money that you get when it comes to nursing, you've got weekend differentials, nighttime differentials, you've got charge nurse differentials, preceptor differentials, clinical ladders. You've got so many things in nursing that you can make bank. You can leave traditional bedside nursing and go do travel nursing. You can do concierge nursing. You can do IV nursing therapy. I mean, there's just so many things that you can do, which is why, yeah, in the beginning, like getting to that point kind of sucks. But once you get there, it's like, well, right? It's just like, it's like a whole new experience for you. So I don't want anybody to ever be scared of nursing. I'm just setting realistic expectations of what to expect because I promise you, you're going to be dealing with some of these things at some point. But I just want you to know that that light at the end of that tunnel is huge. You can literally just do anything.
All right, tonight last question. Someone got a good one.
Okay.
What kind of question do they normally ask in a job interview? A.
Okay.
B. Do they give you challenge questions to check your nursing knowledge?
Bella, great question. I see that. So Bella says, what kind of questions do they ask in a job interview, and do they give you challenge questions to check your nursing knowledge? Yes. So here's the deal. I did a ton of interviews. Um, Being a nursing educator with onboarding a lot of new nurses coming through programs, and even like in corporate nursing, I do a ton of interviews too. But what type of questions are they going to ask you? Typically, these are the common questions they're going to ask you. Number one, why do you want to work here? That's why I say know the nitty gritty about the hospital that you're going to. There's always news. There's always some kind of news about what the hospital's doing in that moment. And if you can remember that information during your interview, it's going to be tremendous, tremendous when it comes to your interview. So they're going to ask you why you want to work there. They're going to ask you usually about like a patient that you've taken care of in the past and how you handled that situation. They may ask you questions about like where you see yourself in 5 years. Not usually 10 years. They don't go that far, but usually like in the next year to 5 years, where do you see yourself? If you say, "Oh, I'm going to work here for a year and then I'm probably going to check out and go do travel nursing," don't say that. You're not going to get the job. Okay? Don't say that. Say, "Oh, I plan on being here for the next 5 years and growing and hopefully maybe, moving into a leadership position." Like, lie. Don't be honest sometimes in these interviews. I can't tell you how many times I've had somebody tell me, "Oh, I'm only gonna work here for about 6 months and then I'm gonna probably go do something else." You're not gonna get the job. So even if that's your plan, lie. They're gonna so sorry. Where why do you wanna work here? What's the most difficult patient? What is your plan for the next 5 years? Um, I'm trying to think of, like, the other common ones that I would ask. Usually, they're gonna give you a patient scenario, just like Bella was asking. They're gonna give you challenge questions like, "You have a patient that's exhibiting this sign, this sign, this sign. What do you think is happening?" The reason they're doing that is they're just trying to gauge your critical thinking to see if you are able to start to put pieces together. You may not necessarily know the correct answer, but if you can at least say like, "Oh, well, I know that with a fever, they're going to have an infection." If you can like start to try to get there, a lot of times they'll help you get to the end. They just want to see if you can start to like critically think and start to put puzzle pieces together. Um, they're going to ask you how you work as a team. Are you a team player? Are you not a team player? Uh, yeah, basically how you work. What are your strengths and weaknesses? I always, and here's the deal. When it comes to strengths and weaknesses, I always say as a weakness, I'm like, oh, well, I care too much. I was told by another job that I cared too much because I advocated for a patient. Don't make your weakness like a big weakness. Don't say, well, I harmed a patient at another, during clinical. No, no, don't say that. Don't, if it happened, that's horrible, but don't say that during your interview. That is not a weakness. Just say that, I care too much. Like make it like a strength, but also a weakness. Like pick something like that. But I think that's like the big things. Those are usually the big things that they'll ask during your interview. Is that sometimes y'all are too honest. Don't be too honest during your interview. We know that you have goals. We know that some of you are going to be CRNAs. We know some of you are going to go back to nurse practitioner school. You're just here to get your experience so that you can move on. Some of you may be trying to get your year in so you can go do travel nursing. Like, we know that's going to happen. But when you say it during your interview, of course they're going to be like, well, I'm not going to invest in this person. They're only going to be here for a year, or they're only looking to get this experience, right? Stop being so honest during your interviews. Sometimes you got to lie, and it's okay. Don't lie too much. That don't try to act like you have all this experience and you don't, but don't be so honest that it prevents you from getting the position because you were way too honest. The other thing too is don't burn bridges. So if you have worked for a hospital before, and don't ask me why I know this, but if you've worked for a hospital before and you put down that you worked for that unit, and that unit's like, oh, I have a really good relationship with that manager, and you did not have a good relationship with that manager, don't act like you had a good relationship with that manager. Because trust me, they're going to talk to those other managers if you worked in that same hospital organization, and you're probably not going to get the position. So sometimes I don't even list, oh my gosh, I'm putting like all this out there. I don't even list places that I worked at for a short period of time because it's none of their business. If I didn't like the place and I moved on because the workplace was toxic, I don't even list it. What I'll do is I'll just put on my resume that I worked like a little bit longer at the previous position or someplace else. So that way because what are they going to do? They're going to call and ask like when you worked. A lot of times these hospitals don't even get references if we're being 100% transparent. They don't really care. It's more about how you interview. So yeah, stop being so honest during your interviews, y'all. I can't tell you how many interviews I had where people would be like, "Oh, I'm here for 2 years and then I'm gonna go be a CRNA." I'm like, that's cool. Like, talk to me about that 2 years from now. Don't tell me about it right now. Just stop being so honest. Listen, healthcare is gonna lie to you sometimes. They will. They're gonna lie to your face. They're gonna be like, "Oh, this is the way we've always done it." No, it's not.
Oh yeah, we have a safe patient.
Or you're going to get an interview. You might ask, and here's the other deal. When it comes to your interviews, ask at the end of your interview questions. If they say, is there anything that you want to ask us? Don't go, no, I'm good. Ask, be like, no, what is like your patient population? What's the common ratio of patients I'm going to see? What is my orientation going to look like as a new graduate nurse? How long is my orientation? How do I know when I'm going to come off orientation? Like, ask those questions before you make a decision to go into that unit, because they're going to, by you asking questions, it shows them that you're actually really interested in what that position is going to look like to them, right? So I've had hospitals that I interviewed at that they were like, "Oh yeah, working in the ICU, you're only gonna have one patient, sometimes two at most, but definitely no more than two." I can't tell you how many times I worked in the ICU where I had like 3 or 4 patients sometimes. That was a complete lie. I even had situations in PCU that I worked in where they were like, "Oh yeah, max 4. Usually we like to keep you at 3, but the max you're gonna have is 4." Sometimes they had 5 or 6 in the PCU. So just know that you're not only lying to them, they're also lying to you. So it's okay. It's just where we work. It's the environment we work in. It's okay. Nurse Chung said it's okay to lie, but don't lie too much.
YouTube make videos and a lot of people want to like get all these tips.
Tips in what? You want me to make a video? What do you want me to make a video on? You tell me.
Like
Let me get a new sticky note.
like interview, most asked question. How do you like what questions?
So interview
Interview tips.
most asked questions
Yeah.
and tips.
Yeah.
Okay.
How you ask? What kind of question you should ask as an interview?
Questions you should ask for an interview. Okay.
Yeah, like something related.
So just interview. You want a video on interviewing? I'll do an interview on interviewing.
So last question.
Yes.
Quick.
Yes.
How to increase chances to get to labor and delivery as a new grad?
Oh. So here's what I'll tell you. So the question was, is how do you increase your chances getting into labor and delivery as a new graduate? I will tell you that NICU, labor and delivery, yeah, those are the 2 most competitive units when it comes to like the pediatric, neonatal kind of areas. So this is what I will say. It's going to be very hard, not impossible, but it's going to be very hard to get an interview. If you really want to get your foot in the door, you are going to have to look for an externship. If they don't have externships available, ask about volunteer hours. Because I'll tell you specifically for NICU, the one girl, I think she reached out to me about, oh gosh, I think it's been 3 years now. She wanted to work in NICU so bad, but she knew that her chances of potentially getting that position was going to be very low. She tried to get externships, it didn't work. So what she ended up doing was she reached out to the hospital and asked, "Hey, is there volunteer opportunities in the NICU?" A lot of times NICUs will have you volunteer and literally just come in and hold babies. They'll literally put the baby in your arms while the parents are away, they're working, or maybe the mother's recovering, and they just need somebody that's going to be like skin to skin with a NICU, a newborn. You might be that person, right? You might be the person for that. So if they see you, they're constantly putting in your hours, putting in your volunteer. Make sure you're talking to the nurses, you're talking to management, you're talking to leadership. Just casually mention, "Oh yeah, I'm in nursing school. I'm volunteering because I want to see what unit's going to be the best fit for me." Don't straight up just say like, "I want to work in NICU. Please hire me, please." No, just say like, "I'm trying to figure out what's going to work best for me and where I want to end up when I leave." And so far, I really really like the NICU. Continuously keep going there, continuously keep volunteering, putting in your time. Yes, it sucks. You're not going to get paid for it, but you will increase your chances of getting into those more difficult places like labor and delivery and NICU if you are able to do that. Trust me. Any way you can get names of managers, get your face in front of them, even if it's unpaid, unfortunately. You don't have to put in like a whole bunch of volunteer hours in one day. Even if you went in and just said, "Hey, I'm going to volunteer for an hour or two," that's going to set you up tremendously when it comes to getting your foot into those positions. The girl that I was talking about 3 years ago, she would go volunteer at the NICU. And then when she got out, she already had a job waiting for her when she got out. And she's making bank. Because NICU nurses make a lot of money. The higher acuity you are, the more money you make. Trust and believe. Because you're more valuable because you have a higher skill set than most. Yeah, and I'll do that video on, like, interviews and, like, how to come across as, valuable to the person that you're interviewing with, and then, like, tips and tricks of how to, like, get through that interview and, like, common disease processes they'll ask and things like that. I think that's gonna be huge. I'll definitely do that video for y'all. Okay, I think we're good. Yeah?
Yeah,
Answered a whole bunch of questions. All right, everybody.
enjoyed it. Yeah.
Well, this was great. You all had some really, really good questions. And remember, we do this every single Sunday. So if maybe your question wasn't answered tonight, or maybe you want to like come in next Sunday and you have a different question that you forgot to ask, it's okay. We'll be here. So remember, every Sunday at 6 p.m. Eastern Standard Time, forgive me. We'll be here answering your questions when it comes to nursing, when it comes to education, new grad, whatever it looks like, whatever I can help answer. I have been in the medical field for a little bit, so I know a little bit from both the administrative end and the bedside end to help kind of alleviate some concerns and maybe some anxieties you have about the field. But this was really good conversation. Wow, thank you all so much for coming. This was a really good one. We'll be back next week with more Sunday shift. And remember, for my teas, folks, we'll be back tomorrow with science on Monday. We're going to have reading or English on Tuesday. Don't quote me on what it is because I'm not sure yet. I just got back from my vacation. And then Mr. Cheung will be back on Thursday with math. So I hope that you all have a wonderful evening. Thank you so much for being here and being a part of the community.